While some degree of scarring is normal and should be expected, it can also be a visible indication of having undergone cosmetic surgery. Stay tuned to learn how you can minimize the appearance of scars and aid in the healing process for beautiful results.
As surgeons, we do a variety of procedures. Do we get scars in all those procedures? Not all, but in most. The ones that don't have surgical scars are laser type of treatments that treat the skin in a different way. They don't have an incision or a cut. Realize that a scar is the trade-off that we have to make to get where we want to go. Fortunately, we get to choose most of the time where we put the scar, and we choose places where we can hide it the most, where it's not as visible to you or to other people. What are some things your surgeon can do to minimize your scarring? Number one, pick a good place to put the scar. They can be in the crease of an eye, in the fold in front of or behind an ear, behind a hairline, or right at a hairline where hair actually grows through the scar. On the breast, if we're doing an augmentation, there are good places to hide scars, but if we're doing a lift, it's not as easy. If we're doing a tummy tuck, there's usually a pretty good place to hide a scar. Don't put too much tension on the scar. We actually tighten all the tissues underneath. And by doing that, there's less tension on the scar line itself, and that leads to a better scar. The incision may be long, but for us, we would trade the longer scar for actually not having one that is as wide or gets thick. Those are more difficult to camouflage or to hide. Scarring is not all dependent upon the procedure or the surgeon. You do bring something to the game in how you're going to heal. People of different ethnicities make different types of scars. Some make them thicker, some make them darker in pigmentation. Good healthy diet so you have good nutrition so you can heal. That's important. Not smoking so you don't have inner things interfering with the healing. That's important. Taking care of yourself afterwards, not putting too much stress on the surgical site. That's important. Keeping tape on the incisions. That actually is nice to help keep them flat, or using some silicone types of dressings and sheets or adhesive glues that we can give you. Typically, if you've made a bad scar, perhaps it's because of tension or there was a problem with the healing of the wound. Well, when you go back to have that scar revised, it's generally not as big of a surgery as your first surgery was. We also have to cross our fingers and hope, because some of it's dependent upon how you yourself heal. Click the link in the description and read our blog post about cosmetic surgery and scarring, and post your questions in the comments section so we can answer them in our future videos.